Well, as kids across the state head back to school, health officials say parents should be aware of measles. Right now, the health department is reporting the highest number of cases since 2017. Danny Spiewak joins us now with more. Danny?
Julie, Minnesota has reported 36 cases of measles so far in 2024. Compared to other diseases, that is a smaller number. But pediatricians say the increase is concerning and shows why it's important to get vaccinated.
Measles isn't just any disease.
Measles is actually one of the most contagious illnesses that we know of.
Dr. Gigi Chawla heads general pediatrics at Children's Minnesota.
Measles really doesn't have any boundaries. It will spread to whomever is not vaccinated.
After the U.S. introduced a measles vaccine in the 1960s, cases dropped dramatically, and the disease was declared eliminated in 2000. But in recent years, plummeting vaccination rates have brought measles back.
So it really puts kids at most risk, potentially kids under the age of 1, where we recommend that first measles, mumps, and rubella vaccine to be given.
In Minnesota alone, the rate among kindergartners with their full MMR vaccines dropped from 92.6% in 2019 to 87.7% in 2022. Well below the national average.
Some locations at as high as 40 or 50% are not vaccinated.
Dr. Michael Osterholm, a leading expert from the University of Minnesota, raised this alarm in an interview with us earlier this year.
I think the state is doing everything that it can to encourage parents to vaccinate their children. The problem is we're seeing a very rapidly increasing number of kids not vaccinated, and that is an absolute recipe for disaster.
The skepticism has been driven in part by debunked claims linking the MMR vaccine to autism, even though 9 different CDC studies have found no link.
There is no increased risk for autism, but some of those myths still persist and puts our whole community at risk.
For community protection, the World Health Organization says roughly 95% of the population should have the MMR vaccine.
It's one of the most effective vaccines that we have.
Measles, of course, is not the only illness to keep an eye on this fall as the school year begins. The FDA also just approved a new COVID vaccine, and flu and RSV vaccines are expected to be available this fall as well. Julie.
Thank you, Danny.